Tuesday, August 8th, 2023, is a date that Hawaii residents and all of America will never forget. The fire was the deadliest in the U.S. in the past 100 years, and 1 year later, even as the recovery goes on, caregivers and first responders are reflecting on what was learned. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Petterly with AHA Communications. In today's podcast, hosted by Ben Wise, Senior Program Manager of Operations for AHA-funded partnerships, we hear from those who were on the scene as the historic fire scorched the beautiful island of Maui last year. Hilton Raethel, President and CEO of the Healthcare Association of Hawaii, describes how the tragedy unfolded and what healthcare providers did right and perhaps would do differently next time. The local healthcare system and larger community have largely overcome immense adversity in the wake of the wildfire, but as Raethel notes, we'll be dealing with the consequences of this disaster for many, many years.
Hilton, thank you so much for being here today for this important conversation. I was wondering, just to start, if you could take me back to a little over a year ago, early August of 2023, and tell me, when did you first hear about the fires and when did you fully grasp the severity of them? And even what were your initial thoughts regarding the hospitals and health systems in the area?
We first heard about the fires on the morning of August 8, which was a Tuesday of last year. And like in many places, fires occur. And so you just track them. We heard later that morning that the fires, at least the Lahaina fire, was contained, and the Kula fire was burning. But the Kula fire is more of a what we call upcountry, more rural, and the Lahaina fire was in some brush and some grass. However, later in the afternoon, we heard that the fires had flared up again. We did not know, however, till at least on Oahu, which is the main island here, because Lahaina is on Maui, a separate island. We did not know until very early the next morning, just on Oahu at least, the severity of the fires. I started getting texts about 2 o'clock in the morning on the 9th. We started to realize very early that morning just how significant the fires had been. What we did not know until later that morning, which was the 9th, about around 9 or 10 o'clock, that people had actually died, because we were talking to, I was talking, for example, the evening before and early the morning to the governor, who was on vacation with his family on the East Coast. And at that point in time, we knew there'd been some damage, but we were not aware of deaths. So we did not become aware, at least on Oahu, we did not become aware of the deaths until early the next morning. What we didn't know is that over 90 people had died that prior evening and overnight. So it was a very, very challenging situation. Part of the problem was that the landlines were down because of the fires, because it destroyed most of Lahaina. The landlines were down, the cellular towers were down. And so communication and the people on the ground, the emergency services, fire, police, they were focused just on taking care of the community, trying to put out the fires, trying to protect, get people to hospitals, for example. They were focused on what was right in front of them. There was a breakdown in communication between the people on the ground in Lahaina, which is on the west side of Maui, and even the county, Maui County, and the state, the governor's office, the emergency management office. So that communication did not start to build until Wednesday the 9th. So over 2,200 structures were damaged or destroyed in Lahaina, 85% of which were residential. And in Kula, the upcountry, there were about 700 acres destroyed and burnt, and there was about 19 homes destroyed. About 8,000 residents were displaced. And this has been described as the deadliest fire in the U.S. in the past 100 years.
And the logistical and operational and geographical aspects aside, the immediate health impacts must have also been profound. What stood out to you or stands out to you in terms of the challenges faced by those communities, especially in Lahaina and Kula?
Fortunately, we have a very good healthcare system in Hawaii. We have one primary hospital on Maui called Maui Memorial and a couple of critical access hospitals. A lot of tertiary services are provided on Oahu. It's a small state. We only have 1.4 million people in the entire state. So, for example, we only have one level 4 NICU. We only have one major trauma center. We only have one major burn center in the state. The burn center is at a hospital called Straub, which is on Oahu. So there were 82 people admitted to hospital in the first couple of days. 71 of those went to Maui Memorial, the hospital on Maui, and 11 were flown over to Oahu. The majority of those ended up in the burn unit. Now, we only have a 4-bed burn unit at Straub. This was the largest number of burns that we'd ever had in that hospital. So the burn unit expanded into the critical care unit at the hospital so that we could accommodate all these burn patients. Fortunately, we have a great team of doctors and nurses who are able to take care of those 11 patients. Unfortunately, we did lose one of those after a few days because of the extent of the burns. We also had almost 700 outpatient visits in the week after the fire. There were two phases of outpatient visits. Apart from the inpatient, people who had significant injuries, the outpatient visits, there's a lot of outpatient, minor burns, just smoke inhalation, things like that, cuts, bruises. So there was this initial wave in the first 24 to 48 hours. What we discovered is that when the shock of this whole trauma, of this disaster set in, some people 2, 3, 4 days later, once the adrenaline had settled down, once they'd sort of, taken a little bit of stock of what was happening, they realized, oh, I've got a burn, or, my feet are burned, or I've got a bad cut. And so we had this initial wave of visits to the hospitals, and then that second wave a few days later. Fortunately, there were no nursing homes or hospitals in this area, either in Lahaina or Kula. And so we did not have any major structures that were damaged or even burnt or damaged. There were 3 physician clinics that were destroyed. There were pharmacies that were destroyed or damaged or shuttered because of the lack of staff. And there were many houses and businesses that were damaged or destroyed. So our immediate concern was ensuring that all of those inpatients, all of those outpatients were being taken care of.
That's a really interesting thing to reflect on. And thinking about those immense response efforts and needs that you're describing, I'm curious as to what you and your team at the Healthcare Association of Hawaii were doing to kind of step in to support these healthcare workers and the patients and even the broader community during these critical early moments.
A fire like this, when most of a town burns, it means that houses burned, cars burned. People didn't have transport, for example, because all their cars were literally destroyed, burned to the ground. So everything in the house was burnt: licenses, passports, medications, baby formula, diapers, toothbrushes. All of those things were destroyed. Many people only had the clothes that they were wearing. So, and then we had the landlines and the cellular towers were down. We had healthcare workers who lost homes, lost all their possessions, and they were sleeping in the hospital or the long-term care facility, taking care of patients. They had lost everything, but they went to work, they took care of patients, and then were sleeping in the hospital because they literally did not have a place to sleep. So there were 2 sets of emergency services. We have an emergency services team funded through the Hospital Preparedness Program, the national federal program. We had our team on the ground within 24 hours of the fire. So the fires happened on the evening of Tuesday, afternoon and evening of Tuesday, and overnight. We had a team on the ground Wednesday morning. They were embedded with state and county officials. We were working with, one of the challenges we had was medications. Again, people lost medications. Everything was destroyed. So we had about 8,000 people in what we call congregate shelters, which is stadiums, high schools, things like that. And we had teams of people come in primarily from Kaiser and our Blue Cross Blue Shield plan, talking to these individuals to say, what sort of medications do you need? And the challenge was that we had all these people, thousands of people, literally in these different shelters that were trying to survive. We would do the rounds, the nurses or the doctors would do the rounds in the morning and saying, what sort of medication do you need? Which those orders would get sent to a pharmacy, which is on a different part of the island. And then the medications would be brought back in the afternoon. The problem is many of the people who were there in the morning were maybe not there in the afternoon or moved to another shelter or were with friends. We'd set up the system very quickly, for example, for vital medications, which are critical for individuals. But we had for the first few days about an 80% return rate because the people in the afternoon were not there in the morning and we couldn't track them down. So we're having to send medications back. We worked to coordinate volunteers. There were so many volunteers. We were getting, again, all of these basic supplies, basically setting up a free store next to these congregate shelters where people could just go and get all of these basic supplies, including, again, things like toothbrush, toothpaste, clothes, anything they needed. We had dialysis patients. Again, they'd lost their transport. They didn't have their homes. So we're having to shuffle around. Dialysis is obviously a critical service. We were having to arrange transport for patients to get from these congregate shelters, these large shelters where they're sleeping on cots on the floor of these stadiums. They had to still get to dialysis. So there were many, many details that our teams, along with state and county officials, work with to address the immediate needs of these individuals.
And it sounds like there's a theme of a lot of collaborative work happening here. I was wondering if you could maybe speak a little bit to what those collaborations were and how they kind of helped aid across sectors to the recovery response that was going on.
Well, collaboration is incredibly critical. Disasters, by definition, are chaotic. Every disaster is different, and it takes days and even weeks to build systems. It depends on what's destroyed, where people are, how people are being moved around. We're incredibly fortunate in Hawaii that because we live on these islands out in the middle of the Pacific, 5 hours from the West Coast, people have to rely on each other. They're used to working with each other. So we're very, very fortunate that we as a healthcare association have very close working relationships with the governor, who happens to be a physician. We work very closely with the lieutenant governor, with the Hawaii Emergency Management Agency. We work very closely with the counties as well. And so because we know who these people are, we have these relationships, we have email addresses, we have phone numbers, we were able to put teams of people together very, very quickly to help coordinate this in all of this chaos. And if you don't have those relationships set up, if you don't have that level of trust, then it's much harder. If you're calling someone up and say, look, we need to deal with dialysis, we need to deal with medications, we need to deal with whatever it is. If you don't have that level of trust built up, it's going to take a while for people to say, well, do I want to work with you? We even had payers, for example, Kaiser and Blue Cross Blue Shield of Hawaii, they stepped up tremendously. And they had their pharmacists, for example, they had their behavioral health specialists working with us, coordinating with us. So the whole community came together. And I'm not saying it was all perfect, it was a very, very chaotic situation, but we were able to build these systems, bring in mobile clinics, make sure people got dialysis, make sure people got medications, and build those systems in a very short period of time.
That's so interesting and also encouraging to hear that collaborative work happening. And I suppose now thinking not necessarily in those immediate moments, but here we are a year later. I was wondering if you could maybe just tell me about some of the long-term challenges that have come from this and in recovering from the wildfires and any lessons learned.
So one of the things that was really critical was emergency proclamations. And again, we have a very close working relationship with the governor and the attorney general. And it was really critical that we get these emergency proclamations in place. And we're still operating under emergency proclamations to this day. We are currently on our 16th emergency proclamation. In the state of Hawaii, an emergency proclamation can only be in effect for a maximum of 60 days. So we've had a whole series of emergency proclamations. And some of those things, for example, is being able to bring in staff from the mainland. And if you're a doctor or a nurse, a behavioral health therapist, for example, and if they're from the mainland and they have a valid state license on the mainland, but they're not licensed in Hawaii, the emergency proclamation allows them to work in Hawaii without getting a state license because it takes a while to apply for a state license. So we're very fortunate to have that. We don't have enough behavioral health therapists. There's a huge amount of trauma that goes on when a community gets destroyed. We were short of behavioral health therapists or behavioral health professionals even before this disaster, and the need just went up dramatically. So again, one of the emergency proclamations, we have a waiver so that people could do telehealth, for example, consults. Now, normally you need to do an in-person visit before you can establish a relationship and do a telehealth visit. So that was waived, for example. The ability of being in-state to prescribe narcotics, that was waived as well. So again, we had this series of waivers that helped us and are helping us to this day to help take care of the community.
Tell me about the community a little bit. What's special about it, and what makes it resilient in the face of something as big and disastrous as these fires?
We have this concept in Hawaii called ohana, which is family. And there is a very, very strong sense of family, of community. And this has been incredibly challenging, again, to have literally thousands of people displaced. Just over 12 months later, the rebuilding has started. We've had incredible support from FEMA, and we've had incredible support from the Corps of Engineers as well. President Biden has been here. We've had members of our congressional delegation been out to visit. Support all the way from the president through congressional delegation, through FEMA, for the local community has been incredible. There are a lot of long-term effects from a disaster like this. We have a survey was done recently by the University of Hawaii, and 46% of the Maui residents had reported that their health had declined in the past year. We're going to be dealing with the consequences of this disaster for many, many years. It's a multi-year recovery, and we are working very hard to rebuild. There's just some houses have started to be rebuilt. Some of the businesses have reopened. There are people who have left either Maui or left the state because of these fires, because they don't know how long it was going to take to rebuild their community. However, many people, the majority of people in the community, do want to rebuild their community. They do want to stay living in that area. And those rebuilding efforts are starting right now.
And out of such difficult circumstances, I just really want to express gratitude for everything that you and HAH and all the healthcare professionals in the area have done. And thank you for taking this time to speak with us today. And I really appreciate all that you do.
You're very welcome.
Thanks for listening to Advancing Health. Please subscribe and rate us 5 stars on Apple Podcasts, Spotify, or wherever you get your podcasts.